what it's going to be. And next we have Dr. Prasanna Venkatesh Ramesh, who is going to tell us about his virtual reality ophthalmic ocular metaverse or VROOM, and the headset which will show you all these, the metaverse is right here. So if somebody wants to see the headset, they can do that also. I'll be down on the floor with the headset.
Yeah, Dr. Pavitra, can you just come here? I have with me Dr. Pavitra, who has the headset with her. So as I'm doing the demonstration, she'll also be coming to you, and we'll try to have a demonstration at your place as well. So I'm Dr. Prasanna Venkatesh, and thank you, John sir, for giving me this opportunity to talk on the innovations that I have done. And this is a wonderful IC to be a part of. And yeah, can I have my slides? Okay, you connect in yours. Connected? Okay, thank you. So, virtual reality and augmented reality. So these were some of the things that were least explored in ophthalmology, and we wanted to really see how far we can go with it. Yes, can I have my slides? Yes, so I'm Dr. Prasanna Venkatesh, and let me welcome you into the world of Metaverse. So once these things were thought as only science fiction, right? It was not really thought as really as a reality, it was science fiction. So why can we make, or how can we make something as a fiction a science-based reality? And Dr. John and Dr. Pavitra will be also coming to you and showing these ophthalmic innovations of Metaverse, which is a patent-protected innovation of ours, which I'll be speaking simultaneously as they come to you and demonstrate it. So I started my journey, and these are the 6 templates that I'm going to take you through. The phase 1 was always animations. So I wanted to really make animations to show how I can differentiate a simple iris process from a peripheral anterior synechia, because I was a glaucomatologist and I was finding it difficult to differentiate simple anatomical structures. So what is a peripheral anterior synechia? At different levels it can be, or what is an iris process? And then take my students or neophytes into, this is how an iris process is. You can see the fine arborizing strands. It does not cause any issue with the intraocular pressure, or it does not cause any issue in the structures visualizing behind it. Whereas in a PAS, you can always have an IOP issue, or you can also have the difficulty in the structures seen behind it. So these were simple videos which I used to train my neophytes, or rather, I used to talk to myself on a cognitive 3-dimensional imagination. And then I thought, why not we make an atlas on a pupillary block? Because that is why we end up doing the PI, right? So everything was actually an imaginative learning. And we went into YouTube and I saw what are the things that are not there. So why do I do a YAG PI? If somebody asks me, can I give it in 10 seconds? So this is what is the cause, and that is why the effect happens here, and we open it by opening it up here. And this search of thirst to create a cognitive pedagogical medium was always there, and a simple glaucoma. So some of my patients explain to me, so can you explain to me what is glaucoma in a single minute? So these were some of the things that I started making on my own data. A fundus photograph, you can see, it's a 1-minute video. I zoom in, I show them the vertical cupping, I show them the bionetting sign, I further zoom in and show them the basic sciences of ISNT rule, how it is breached in a glaucomatous patient, and that is why you have this RNFL defect here. And why I need to do a visual field for you is because I want to do a structure function correlation, and then I place the OCT and reduce the transparency of the patient's data and tell them, see, that is why I want to do an OCT. So I am ordering these investigations because I want to know more about your pathological condition, so that it will help me understanding better. And this is a minute video. So it started with cognitive video-based learning for me, my Metaverse journey, and these are some of my publications in the Indian Journal of Ophthalmology in February and June, a video-based one in IGO videos. So the thirst was always there to push ourselves more. Like, what is the difference between an ALT and an SLT? So most of my videos are restricted to glaucoma, but let me see how I can do justice to the other fields as well, as we are now collaborating with further like-minded peoples. The spot size, how it is different. What is argon laser peripheral iridoplasty? You end up reading a lot about it, but then these are the normal angles, these are the oppositional angles, and these are the laser that you do to open the oppositional angle, you can see. So this is a side angle view. Can I have a front angle view to show how it really opens up from a front angle view. So you can see the 360 degrees and 24 spots being placed, and then a gonioscopic view, because always we kept pushing ourselves into different views, where in a gonioscopy, how does the root of iris gets pulled from the oppositional angle that it is actually having. So this led to a lot of videos, and this is my channel there, and it goes under my name, Prasanna Venkatesh Ramesh itself, which you can go and see all these videos that we have created, a video-based atlas. So that kept pushing ourselves further and further into basic sciences. What happens when we remove a lens? So all these video-based animations are done by us. The fall of the ciliary body, the fall of the scleral spur. So we started making a lot of 2D, 3D models, and this was a 10-year journey, the break of a PAS that happens post-cataract surgery. And then we started creating these models into different plane of choices, like the ciliary, the cavernous sinus, the circle of Willis, the eyeball model. So now we were starting to develop the holograms in 3 dimensions, and we were looking at a medium as to how we can evolve from animations to unanimations. And we started by giving an app to the users, like they can actually click a button and they can go into the frame of choice that they want to see. If they want to go into the posterior segment, they choose what they want to see. Why not? I being the user, I don't control what the observer wants. I give them the option, and they were going into it, and they were choosing their frame of choice as to what they want to see. And we started collecting the models. You can see different pathological models of various pathological conditions: retina, glaucoma, myelinated nerve fibers, splinter hemorrhages, neovascularization, and we launched it in the Windows as well, and we published it in the Indian Journal of Ophthalmology Innovation section in 2022. So that led to the creation of the augmented reality models, where you can see that we were able to crack augmented reality in the year 2021, and this was the first real-time confocal images with the fundus and the angle holograms that was created in ophthalmology, where the right-hand side you can see the video that is synced with the video that he is showing in his smartphone. So on day 1 in med school, a person can actually be oriented to what he can actually see that a retina surgeon is seeing or a glaucoma surgeon is seeing, because angle surgery is something that is really on the boom, and we focused extensively on angles and fundus photographs. Not only the fundus photographs in color, but autofluorescence, infrared, and whatnot. You can see that were the unique feature of our models. We use real confocal, true color images, and you can see that angle structures. This is a phone recording of the same application, IMG-AR, that we innovated, and we started collecting the same models, NTG patient with a splinter hemorrhage, retinal nerve fiber layer defect with a wedge-shaped defect that you can see here, that the same patient's data was getting pulled up, and we went ahead, evaluated this, and published it in the European Journal of Ophthalmology, and we validated it. Then we wanted to push ourselves further into the headsets that you can see Dr. John there very curiously trying to demonstrate along with Dr. Pavitra. So can I catch these models in a very portable way without any hi-fi technology at this particular place where he's trying all sorts of things? You can see it from outside, it appears as if it is totally foolish and the person is insane, where you can see Dr. Pavitra there trying to catch butterflies with the headsets. But this is what happens, right? See my friend on the right, you may see him on another day and think him is insane, but he's actually demonstrating these holograms of the eye in a 3-dimensional plane, the angle structures, the fundus in color, autofluorescence, and infrared. The same models that you saw, you can see that he's demonstrating the retinal nerve fiber layer defect, he's demonstrating the RNFL defect, the wedge-shaped defect, and this is pushing ourselves into other OCT filters and whatnot, because with more filters, you can actually differentiate an hydrodissection from a delineation and improve your surgical skills, along with multimodal retinal imaging. And very important is the neuro-ophthalmological models that we created. So we sat and read the anatomy and created the whole 3D models so that learning and cognitive mugging up is avoided, and you can actually see the neurological models for the way they are, and it is going to be there, and we published this in the August issue 2022 in the innovation section of IJO. I think this is the future, my dear friends. My daughter, she's very fond of this. Whenever I go home, she takes it for her own. She has created her own butterflies in her metaverse. I think this is going to be the future where we are going to have this in everyone's home, and we are trying to push ourselves even further, where we can incorporate OCT into the fundus so that you can actually extrapolate OCT slices from the fundus, and you can actually, before treatment, after treatment, a striate keratopathy for that matter, or anything. I think in the future, EMR is going to be 10 years or 15 years from now. I think the patient is going to come and we will have all the data of the patient, a Christmas tree cataract or any cataract for that matter, will be completely dissected in the three-dimensional plane, and we will be making our phaco parameters, the dissection plane of hydrodissection or hydrodelineation in a posterior polar cataract, and we are trying our level best to bring it into Android, Apple, Windows, Microsoft and whatnot. So recently we innovated the first mix simulator in 4D, where on the right hand side you can see this is all synced. The left hand side you can see what he'll be seeing through his eyes, and this is the first MAGS simulator that was made to make sure that any mix surgeon, it will help them evolve quicker, so that you can see he goes to his wet lab. Every time the stent is placed correctly, it turns into green. You train yourself 30 times, 40 times, 50 times, and then you are ready to go ahead and you place the stent. So we have created puzzles also, we have printed puzzles, that is also part of our metaverse, and we have published it. We have created subtractive learning where you can choose and you can subtract structures, so that we want to give the audience the complete freedom of choice and have a simulator in a smartphone where even the fundus simulation with your smartphone, you move forward, you move back and whatnot. So this is a very promising field, my dear friend. We call it the 4D ophthalmic metaverse, and this is my team. I have my own startup called the Mahatma Center of Moving Images Private Limited at Trichy, and we are trying to push ourselves, keep pushing, and we publish our work, we innovate our work. You can take a screenshot of this. This is where you can find us, you can catch us here, and we keep doing all crazy things, and we have won, these are the awards that we have won in different conferences for all our images and all our innovations. I thank John sir and the whole team for giving us this opportunity and to showcase all our publications and innovations in the metaverse that we have made. And once again, thank you for this wonderful team. It's an honor to share the dais with such a wonderful team. Thank you once again for the opportunity.
Thank you one and all for this. Thank you, Dr. Prasanna, for this metaverse. So he actually came to Kochi last week for our glaucoma metaverse. So the glaucoverse for our glaucoma week program. So thank you, Dr. Prasanna. And in VRSI, you're going to see the retinoverse, right?
The love is always for glaucoma, so you can see me green.
So you won't see him. You will see his better half, Dr. Anu, coming for the retinoverse in VRSI as well. And I don't know, what is cataract verse? Phacoverse? Yeah, we will see all the universes, the various...
Dr. Ashish sir is there for the cataract verse.
No. We are going to be taking the verse.
Okay.
So we will be doing all the various universes, right? How many are there? Right, so